By fixing your poor dental health, fixing your airway, you could give yourself a facelift. Yes, you heard that right, a natural facelift. We're going to discuss in this video the link between poor dental health, having cavities, inability to lose weight, and having a prematuring aging look. And I'm going to show you an interview I did with a very special dentist, Dr. Hyun Bong. She's an airway-centered dentist, and she's going to break down this connection between fixing your dental health and losing weight and having younger looking skin. But before we get into that, I want to show you a quick clip of a customer of mine who bought my kit, did it faithfully, and saw these exact results. Reversed her dental health, as well as lost weight, and had skin that, according to her, looks like silk. Watch.
They told me that I need operation on my gums. And I had pockets that is 9 millimeters. And all of these pockets was terrible. I took the nutritional powder and all the kit with the book and everything that I needed because that was my last chance. Month later, my skin changed, become like a silk, and I see big difference in my energy level. I see big difference in my pain level in my arm.
And so we got in touch, and I answered some of your questions. You bought the protocol kit, and you read the book, and you started doing everything faithfully. What happened to your skin? What did it look like after doing the protocol?
Before was little bit more bumpy, bumpy.
A lot of texture, uneven
A
texture.
lot of texture.
Yeah.
Now it's like a silk everywhere.
That's cool.
Everywhere, especially my legs down, here up, but was different when I take the powder, was more softer and more silkier when you take the powder. And when you stop the powder, it's still nicer, but it's not that softer.
Interesting.
I mean, it's not that silky as like before. You have all the nutritions. You don't need no lotion, no nothing.
No lotion, huh?
No nothing.
Wow.
Everything coming from inside.
All right, now that was pretty incredible. Let's get into the actual interview and let's find out from Dr. Bong what's this connection and how it is that when you treat your poor dental health, you can drop pounds that you were unable to drop and you could actually improve the quality of your skin. Take a look. If I could just throw out like a nutshell statement, is there a link between your oral airway, poor dental health, and things like insomnia, chronic pain, depression and anxiety, weight gain or inability to lose weight?
Yes, in the sense that they all stem from the same problem. And the common core problem would be the narrow jaw. So we're, as dentists, looking at the orofacial complex. Yeah. And we're checking for cavities and gum disease, but airway-centered dentists go beyond that and look at the anatomical structure of the jaw. And so if the jaw is narrow, the airway is narrow. Okay. Yeah, and so if the airway is narrow, we're going to have a little bit more difficulty breathing. Of course, we adapt to that, but especially at night, we will end up suffering a lot more. And then we see manifestations of that in, multiple dental diseases that we see, tooth decay, gum disease, various issues, tooth fracturing. But we also see the medical issues like what you have just listed, and many, many more actually. Wow. Yeah. But 9 out of 10 people in America have things like depression, anxiety, weight issues, cardiovascular, diabetes, thyroid problems, ADD, ADHD, infertility problems, insomnia, chronic pain. Those things are very prevalent, and we're finding that these people have that same narrow jaw. Yeah. And we also lose weight during our deep sleep cycle too. So during deep sleep is actually where people lose weight. We're actually burning. Yeah, and that's interesting because most people think it's when I'm on the cardio machine at the gym, that's when I'm burning weight, but it could actually be So that could potentially explain why a lot of people are exercising like crazy, but they're not always losing weight. Yeah, also exercise is going to be very important, but when our deep sleep isn't good, then it dysregulates and alters our metabolism.
Okay, so now we're kind of getting into the whole... Yeah, there's probably going to be women watching who fit in this category. I eat like a rabbit. I work out like crazy.
Yeah.
And I just can't seem to, like, I've plateaued. I can't seem to, like, get below a certain weight.
Yes.
And these women are trying to lose weight. So you're saying that could be related to having a narrow airway.
Yes.
And just to kind of, like, back up real quick, anatomically, more and more people, I think we're going to get to this more, our airway should be a certain size, ideally. Yes. But what we're finding is that more and more people are having a more narrow oral cavity and a narrow airway anatomically. And that is leading to all of these issues like sleep disturbances and insomnia. Mm-hmm. And that in of itself is going to, link to all these other issues. And one of them is the inability to lose weight. Mm-hmm. So could you talk on that a little bit? Like, how is that
So this whole problem actually started because of a diet change.
All right.
So food had almost everything to do with it. And then from there came the fast-paced sedentary lifestyle over time. Mm-hmm. So food, when we were living more in a natural way, more of our ancient habits, right? We're foraging our own food, we're growing our own food, we're treating the soil nicely, so the soil is rich in nutrition, and we were eating more whole foods. We didn't process things as much. Yeah. A lot of people during that era had a wider jaw form. All of them had straight teeth, immunity to tooth decay. We're not seeing traces of gum disease either. And they actually had all 32 teeth, all of their wisdom teeth, out and functioning. So like this, because almost everyone you meet at some point has molars, at least one of them pulled. Yeah. And that was not as common. Like, it was more normal to just have all of them. And unfortunately, getting wisdom teeth taken out is considered, even in standard of dentistry, normal. Yeah. But that's because it's so common. But it's not necessarily normal if we have the space for them to come out and we can fully function on it. Right. And now the jaw could potentially have more stability because we have more molars doing the work together. Mm. And what has happened is we adopted sugar processed foods, and the immediate next generation started to suffer from narrow jaw, crooked teeth, tooth decay, and we're talking about the children. Mm. Yeah, so when the anthropology research went down multiple generations and found that generation where we have generalized immunity to tooth decay, these are the findings that they have found. And the big change, social economic change or social behavior change, was basically the change in diet. Wow, that caused this 50% increase in the next generation of crooked teeth and tooth. A 50. So okay. So what would you say this is about? Like the turn of the century, like the early 1900s. About 400 years ago. About 400 years ago. 6 generations ago. So we're 6 generations down. So our jaw is pretty narrow right now. Wow. So previously, people had a normal sized airway, and then refined foods. Refined sugar, refined flours were introduced, and that started essentially malnourishing people. It was malnourishment, in combination with the lack of proper motor function. So when you're eating whole foods, you chew more. If you put a whole piece of vegetable in your mouth that's raw, your body just has to chew more to get it down, for example. And so the chewing efficiency decreased. Also, another problem is with modernization, we're not breastfeeding as much anymore, and we're using the bottle, and that robs the baby of proper motor development, and that motor development guides the skeletal development. So we often say, oh, it's just genetic because your parents and you kind of look the same, but that could most likely be because the parents and the children have the same diet lifestyle habits. Right. Each successive generation that ate on this diet got more and more nutritionally depleted, and the
our anatomy, our oral anatomy, started breaking down and like becoming less and less normal, less and less ideal, more narrow.
Yeah, basically, our body needs to make effort in order for it to grow.
Mm-hmm.
If we put everything on a silver platter and say, don't make effort and just swallow all your food and slurp all your food, then the development just doesn't happen. So we do need to give our children, our babies, the opportunity to feed where they're making the proper amount of effort that is needed for proper skeletal development, which is going to be the most natural way of eating is breastfeeding and chewing whole foods.
Going back to the topic of inability to lose weight, so when people have poor dental health, they have narrow airway going on, that is affecting women's ability to, or I should say women, it's affecting all people's ability to lose weight. Is that just due to what's going on up here, or is that also, is it affecting our guts?
Yeah, so sleep disorder breathing is also linked to gut dysbiosis. Obviously, if we're not getting good rest, any part of the body is probably going to malfunction just a little bit at least, because sleep is when all of our cells repair, everything gets restored and reset and recharged. So deep sleep is when we're getting physical repair and recharge. Our REM sleep is related to our memory. So overall, good quality sleep is definitely going to be affecting pretty much everything, but we do have research that shows that gut dysbiosis affects sleep and sleep affects gut dysbiosis. And to the point where if you treat gut dysbiosis by other types of interventions, maybe diet and other lifestyle regimens, we actually see the blood pressure issue that's related to sleep disorder breathing actually decreasing. Yeah, so there's a link to that. And gut dysbiosis can cause a bunch of other problems like autoimmune disease as well.
Yeah.
As far as weight, I can tell you my patients are losing weight. I treat my patients holistically, so I'm giving diet, nutritional counseling, but at the same time, because they can get out of bed without hitting the snooze button all the time. They used to before, and now they have more energy, they're more motivated, they're making better choices in foods, and they're more willing to go out and exercise. They're just more relaxed. They're not as high strung as they used to be. Yeah, lots of positive clinical outcomes that definitely proves a lot of this research to be true. Regarding weight, weight and sleep disorder breathing does have a bidirectional relationship. So sleep disorder breathing causes sleep deprivation, short sleep, poor quality sleep, and short sleep, actually there's research that shows that it increases obesity. And yes, and if we gain weight, our body mass index goes up, and our already narrow jaw becomes more narrow because now the soft tissues are really taking over that really tiny space.
Yeah, the mass, the weight on it.
So a lot of people think that sleep apnea is a disorder or an issue that people with heavy weight or weight issues have, but majority of patients with sleep apnea are actually thin.
Really?
Yeah. So it's not the majority that is overweight, it's actually the other way around.
Oh wow, that's
so
weird.
Why would that be? Right? So and then of course it increases with age because the tissues become more collapsible. So that soft tissue has a huge influence on how well you're going to be breathing and sleeping at night.
Oh, okay. So there's multiple factors there that are linking the dental health, poor dental health, airway issues, insomnia, inability to lose weight. It's like this string, where they're all connected. I also want to discuss something that was really fascinating to me, and I think is going to be really interesting to a lot of our viewers. The link between fixing our airway and fixing our poor dental health and looking younger.
Yeah.
So can you delve into that a little
Yes.
bit? Can this actually help us, slow down aging or even reverse some of the effects of aging?
So everybody thinks the body degenerating is sort of a normal part of the aging process, but potentially it isn't. We see examples of people, even in this modern era, who are thriving and they're so healthy in their 80s, and their bodies are all looking almost younger than some of the young people these days.
Yeah.
So there's some examples there, but one of the things that this narrow jaw problem does is it gives us what we call the premature aged look.
Oh, that doesn't sound very good.
So simply put, if we're increasing that narrow jaw and expanding that structure, then the soft tissues will follow, and it's almost like a facelift. When you go to a plastic surgeon and they're putting Botox in there, they're trying to plump up the soft tissues to get rid of some of the wrinkles and things like that, or pull the forehead up. That's called a facelift, right?
Right.
But that just sort of happens naturally because we're improving that collapsed structure by uncollapsing it.
So you could actually, by fixing your poor dental health, fixing your airway, you could give yourself a facelift, essentially.
Yes, I don't like to say it that way. I like to focus on everyone's health, but you do get aesthetic benefits, absolutely.
Wow.
Just because this is that philosophy that I practice by in all facets of dentistry, be it a cleaning to surgery. But what is functional is also aesthetic. So when when our bodies are functional structurally and balanced, aesthetics just kind of fall right into place.
Wow.
Yes.
Interesting. So even people perhaps aging faster than they would like or they think they should, that could almost be like a canary in the coal mine. That there's an imbalance.
Yes, there's an imbalance, and that's causing things to wear and tear differently. But we talked about the sleep deprivation and all of that. So just being sleep deprived and cells not repairing just causes your skin to look more groggy, and you feel more groggy, and you may be frowning more. And of course, if you're collapsed, then you might kind of look like you're frowning more, even if you're not trying to frown. But if you're sort of opened up, then your eyes pop more, and also blood flow. You're getting much healthier circulation of body fluids, and that also contributes heavily. So the diagnostic term, we call it venous pulling bags and dark circles. This is something we see in patients with sleep disorder breathing, and we see that resolving. And in the past, one of my patients, one of the comments they made, "Do you think I'm crazy?" And I said, "No. But why do you say that?" And she said, "Whenever I have the splint in my mouth, I feel like I look younger." I oftentimes don't really tell my patients that this is going to happen. I let them tell me, and we're both, very happy about that.
Of course.
But just with the TMJ splint, that gives us an idea of what it's going to be like when we're expanded. My patients are already telling me that they can tell they look much younger when they have it in.
Wow.
And so that tells you the effect of what the collapsing does and what the uncollapsing does, to the face.
So you see when you are able to successfully expand, and we're going to get more into that later. We're going to get into actually what she does. So hang tight. When they actually get expanded, they're getting consistently more oxygen, better sleep. You see your patients actually looking more healthy and looking younger.
They do look younger.
Wow.
So it's a blessing. And it's just amazing to witness. So, I may inspire my patients, but my patients are always inspiring me.
That's cool.
Yeah.
People are probably dying to find out. So what do you do? What are these devices you're referring to? So could you just, it's probably, somewhat complicated. In a nutshell, explain, what do you do? What devices do you use? What are they doing in your patients?
Well, the types of appliances that I use, we have what we call stem cell signaling, and that could sound sort of out of this world for a lot of people. And
fascinating.
And the term stem cell has been thrown around so much, but it's basically something that our bodies already have. It doesn't have to be synthetically fabricated with rocket science in a lab for you to get stem cells. It's just something we're born with. Stem cells when we're young act as growth factors. Stem cells when we're older act as healing cells. So, when we're wounded and there's inflammation, it comes to help us to heal. When we're younger, it helps us to grow. But if you signal them just right, then it could actually help increase that that growth factor, basically. So osteoblasts and fibroblasts and all those blastic cells. So blastic cells, stem cells, mesenchymal cells, those are all kind of the same thing. And we're signaling them so that they can start to help us grow some bone in the areas we're kind of putting a little pressure and trying to expand and stretch out to. Literally, we get bone generation.
Wow.
Yeah.
So let me see if I understand this correctly. You're putting in devices that are removable for adults that actually physically, slowly but surely expand the palate, but at the same time will actually signal stem cells to come to the area and start to regenerate.
Yeah, so you're literally increasing the amount of stem cell activity.
Wow.
Yeah, and it's all
That's
natural too. It's not like there's a motor in there and like there's electricity or anything like that. It just uses your body's natural vibration. It's just made in a way where it can just kind of like conduct it through these special springs that are in the device, and it conducts it through the teeth into the bone.
Wow.
Yeah.
That's fascinating. Now, I want to get into a little bit of like what you see. You've been mentioning it throughout, our discussion, but what are some of like the results that you're consistently seeing when you treat your patients successfully and you're able to expand their palate and open up their airway? What are the types of things that you're seeing happening?
Since I'm a dentist, the first thing I want to mention is that I see a decrease in plaque level in the mouth. Yeah, so just by decreasing the grinding and clenching that occurs as a side effect of the narrow jaw, decreasing the mouth breathing, increasing the nasal breathing, just the oral bacteria becomes healthier.
Wow.
Yeah, so we're seeing a lot less harmful bacteria, and as a result of that, obviously, we're going to get less tooth decay.
Yeah.
And because we're reducing the clenching and the grinding that happens as a side effect of narrow jaw, we're also reducing the trauma on the teeth. And reducing the trauma is going to contribute to less fracturing, less wear and tear, and also less recession of the gums. Yeah, so all of that kind of works in harmony. So that's definitely some of the results. In some cases, I actually see improvement in recession. Yeah, so it all kind of depends on your pre-existing and what's going to change. But there's the dental benefit there. Everyone unanimously, obviously, is sleeping better, less fragmented, able to sleep through the night, and also getting up in the morning without all the trouble that they used to have. Yeah, so there's that. Everyone's definitely looking brighter and younger.
Wow.
Definitely patients are telling me they're losing weight, their jawline is slimming. So it's really funny because I'm increasing their jaw in size, but then they feel like their jawline is slimming, and mood is better. Of course, in the sleep data that we see, deep sleep, REM sleep is better, oxygen, things like that.
Fantastic. So it sounds like everything gets better.
Everything just falls into place. It's like our bodies were meant to be healthy.
Yeah, it's like the default is health.
That's the default, and we're just bringing them back to nature, basically.
So cool.
It seems like it's the newest thing, but then at the same time, we're kind of going back.
Right.
Yeah, we're going back to nature.
We've kind of touched on it a little bit, but, if you think about how we've been degenerating really as a people, and for the last 400 years, and a lot of the problem, if not the sole problem, was this nutritional degeneration. We started eating really poor quality modernized food. So would that imply that the way that someone at home could start reversing this on their own would be through nutrition?
Yes, absolutely. So I nutrition counsel my patients all the time. I spend a lot of extra time in the chair just on that. So since diet change to something really bad from something really good suddenly cause this drastic change, yes, absolutely, we can reverse this. So even if we're not getting all the structural, therapies that, I render for my patients, lifestyle is extremely important. So, our soil is very depleted in nutrition. And so even if we're doing all whole foods, organic diet, which I'm constantly trying to do, I'm fully plant-based, we just don't get the proper amount of nutrition density in our food. So how do we increase that density? I know you have this wonderful green powder, and it's the least processed you can find that is very easy to keep on the shelves, that doesn't go bad easily. Put it in your smoothies or mix it in some water and drink it. But that is definitely a great way to give a nutrition boost. But that's one thing, and I'm aware that not all of these supplements are going to be very high in nutrition per se, so really look at who's making it. I know that yours was Nutritional Value, when you've tested it, was equivalent to like a 16-ounce bottle of concentrated juice, for example. So something that is nutrition dense, that we're not stuffing ourselves with extra food, but we're getting the proper amount of dietary fiber, not overdoing that, but then the nutrition that goes along with it is also very, very dense. Soaking in sprouting could be one way to do that. Gardening your own vegetables.
Oh, that's the best.
Yes.
People can do that.
And from gardening, you get the sunshine, you get the fresh air, and getting proper vitamin D from the best source, which is outdoor sunshine during midday, when the shadow is a little bit shorter than your body. That's the best time to get the vitamin D, and you're going to actually get more from that. So those are some things nutritionally that I can kind of just touch on.
Well, that goes right along with my research. When I was able to reverse my cavities, what I found out, well, the thing that was shocking to me is 75-80% of my cavities I got while I was a plant-based vegan, not a junk food vegan either. And so that really was like a head scratcher for me. And what I ended, as I delved into the research, what I found was that that's a good basis, but it's not enough to get you past the line from survive into thrive.
Exactly.
And I needed some kind of a supplement to get me there. And the supplement, instead of like some synthetically lab generated, like 50 different pills, and I have like, every vitamin, but it's in its separate synthetic pill form, just getting it in its original packaging was the best.
Plant.
So juicing was a huge thing for me.
Absolutely.
But also nutritional powder, and that's why I created that nutritional powder. And it's having it be focused on all the vitamins and nutrients that are specifically needed, most important for building teeth.
Not only that, everyone's so busy. I diet coach, lifestyle coach my patients all the time, but there's really only so much they can do. And even for myself. So I do supplementation based on, I know when I'm not eating well, and I know when I'm eating well, like if I cook, and so it's really hard to balance. So the powder really helps, because juicing, I love juicing. And when I juice, like for example, if I bite my lip and I get an ulcer, it takes like 5-6 days to heal, when normally it would take over 2 weeks. So the green is definitely powerful. And so I would say go for the nutritional supplements, but the whole plant made into a supplement basically is the best. For those that are interested,
I'll have a link in the description to my my reverse cavity protocol kit, and the nutritional powder is part of that, and it could also be purchased separately as well, but the whole kit is obviously going to be more beneficial.
I was very impressed with that, at being your doctor. I was very, very impressed, though. This is definitely something that should be shared, and everybody could just do this. And we try to put a price tag on things, but you don't get your enamel back once it's gone. So don't damage it, and if it's getting damaged, just stop it right there and supplement that nutrition internally, not just topically. Like we put things on the teeth. I recommend bentonite clays and things with all kinds of minerals, like diatomaceous earth that has silica. But internal boost is going to be extremely important. Our teeth are not inanimate hard objects.
Yeah.
It has pulp tissue inside of it, and a lot of people know that pulp tissue has nerve inside of it.
Right.
But what else it has that a lot of people don't know is blood vessels. So those blood vessels are carrying nutrition to the tooth.
Yeah.
So that's the reason why you were able to reverse it. Yeah. So there you go.
And she, I remember you saw my X-rays, my before and after X-rays, and
they looked beautiful.
Yeah, and I think it's just affirming. People hear me say all the time, teeth can remineralize, teeth can remineralize, but I think it's so affirming for people to hear that from an actual dentist.
Yeah,
this isn't a crazy Gabe thing.
Yeah, so all dentists are going to recommend something to put on your teeth to remineralize, and it could be chemical. Some dentists who are more holistic are going to recommend more natural things like I do. But the internal is usually not addressed and even thought of as possible, but it definitely is going to make a difference, because this whole problem started with diet. Remember that.
You got to address it from both.
From both angles, yeah.
Now, people are probably wondering, okay, I need to expand my airway, I need to, I want to move on this. What can people do now, because here we are in San Francisco, California, at one of your offices here. People are watching this all over the place, all over the world. People are going to be watching this. What are some things that people could start doing today, and maybe they could do, a month from now, to help? Practical things people could start doing. Consider getting
Gabe's Nutrition Powder, and I say that because I spend hours and hours and lots of energy and effort diet, lifestyle coaching my patients, but everyone is so busy. And I sometimes feel like I'm burdening them by giving them advice, because now they have to add 3 more steps to their daily routine.
Yeah.
And so really consider doing something like that. And if you have more time, then consider getting better quality grain. Try to reduce the whole wheat or the processed wheat or the whole wheat, just because it's modern wheat. And modern wheat can do similar things to your body that sugar can do. So go with the more ancient, original grains, or even pseudo grains like seeds, like quinoa or amaranth. Ancient grains could be acorn, spelt, rye, things like that. And look at the ingredients of the bread that you're buying. I don't really like bread as much as just having the whole grain, so I'll have it as cereals or cook it as a rice or something like that. Have a healthier, just in general, if anyone is meat eating out there, you want to drain the fat and blood. That's the best way to consume meat. If we're consuming meat, of course, best quality and the grass-fed would be awesome. But still, the blood carries toxins throughout the body, and the fat stores the toxins. So you don't want to be consuming that. When we're trying to get rid of the toxins, we're get rid of the inflammation.
Great explanation.
Yeah.
And if people want to see more information on that, I'll have a link in the description below to my video where I explain how I reversed 5 cavities in 3 months. And I went through, a lot of the science behind that and what Dr. Weston Price found out, and my own experience, and to show more proof and evidence to support this, and to really see the science of how you can reverse cavities. I was able to reverse cavities even with having a narrow airway, with decreasing the inflammation there through my oil pulling blend, with boosting the nutritional content of my body through the powder. But also a big part of it was being outside, getting vitamin D. If you don't have adequate vitamin D, one study I read says you can only absorb about 15% of calcium without adequate levels of vitamin D. So and you could supplement with vitamin D. The sun is actually the primary source. It's the best. There may be some issues with supplementing with vitamin D. Better than nothing, probably. So obviously one thing that people could do is they could hop on a plane and come over and see you, depending on where they are, which obviously is going to be the more expensive, but I mean, that's something that people could do if they wanted. They could actually come see you and have you treat them. Do you want to speak to that at all? Or?
Yeah, so I do have patients who fly in from out of state to receive this treatment, and that attests to the fact that it is a little bit on the rare side to find a practitioner. And I guess one of the things that my patients like about what I do is it's more comprehensive because I address the jaw, myofunctional, the expansion, and the ortho, all aspects of the full scope of airway dentistry. And also, I am also holistic, and I'm able to help them in other aspects of lifestyle change as well. So that's a benefit. Nevertheless, there are airway dentists in other parts of the country, and it is increasing. More doctors are, doctors who are really motivated to save lives and to who are really concerned about the health of people, are really investing, because it's a huge investment to learn more about this and to learn how to do this. For me, it was a whole career-long path. So you can try to Google search airway dentist, airway-centered dentistry, any other functional, myofunctional therapy, or oral myofunctional therapy. Those are some, words that you can use to search that could potentially lead you to a clinician, who can potentially help you in that area.
So you don't want to hop on a plane to go to San Francisco, so there may be someone a little bit closer to you, and this is how you might find them.
You can, and I would be honored if one of Gabe's audiences came and sought me for help. And I will do my very best to take the best care of you. But
she's the best.
Thank
Very
you.
good. Very good.
Appreciate that. Let's start with exercise. I hope everybody can motivate themselves to go out, and I recommend outdoor. I'll start with a story about before and after the pandemic, what I noticed in my patients. The first group of patients that came knocking on my door, like I need an appointment after we reopened, because we were told to shut down for a few months, right? So I shut down for a few months. Patients came right after that were my patients who had the jaw problems, and they were grinding their teeth and they were breaking their teeth, and these things were happening more rapidly during the pandemic. And I kept seeing my patients coming in waves, I guess. My first wave of patients were all the patients who were increased in plaque level, and I try not to tell my patients why I'm asking, just because I want the most organic response possible. And I kept noticing that my patients who stayed at home, cooped up in a corner in front of their computers, for example, working from home, and very anxious and living in fear, and not going out at all, were the ones who came back with lesser dental health, increased plaque level, and increased jaw problems. And so their sleep quality is definitely suffering there. And then I started to see patients who were coming back with very golden skin.
Yeah.
And I'm like, oh, you've been going out. And I'm like, yes, every day, 2 to 3 mile walk or a run. So younger people are running, or my elderly patients are walking, or they're out camping, so they're going into the woods where it's safer. But they're getting that fresh ionized air, they're getting sunshine, they're getting physical activity, they're detoxing their body throughout the pandemic more than they used to before. And guess what? And I've been seeing these patients for a while, so I know the difference. They're coming back with less plaque in their mouth. Their mouths are clean. I'm able to do simpler cleaning. I started noticing that, and then I saw a group of patients who were exercising, but they were exercising indoors. And they were kind of the same as before. Not much change.
Interesting.
Yeah, and so this is just from my clinical observation. So I started to encourage my patients to exercise more outdoor. So you get a combination of all of the nutritional factor, the pure air and exercise. And my patients who would have persistent gum problems, I would ask them to consider increasing their cardio. And they would increase their cardio. 3 months they come back for a checkup, evaluation, cleaning, and their gums look beautiful. So
exercise.
Exercise, yes, is something that I would love to emphasize, but not just indoors at necessarily a gym. And if that's all you have, then it's better than nothing, but outdoor exercise.
Outdoor exercise is the gold standard.
Is the gold standard, and really, we exhale carbon dioxide and we inhale oxygen, and the trees do the opposite.
Yeah, amazing.
So Yeah, be close to nature. There's a reason why there's that exchange there. We're supposed to live together in harmony. Yeah. But you do some more research on it. Read more. I'm happy to post my website as an educational resource for everybody.
We'll have that in the link description. Yeah, the link in the description.
Yeah, it's called revivesleepstudio.com. But from there, read some books on it and try to find a practitioner in your area. Tell your friends and family about it, that there is a way to be healthier. And a lot of people who hit rock bottom or hit a wall trying to do all these different regimens and like the weight's not improving or whatnot, this is something that you can tell them about, and people could have more hope. Yeah, or at least answers if there's no therapy being rendered.
Yeah.
And having answers is huge.
Mm-hmm. Well, Hyun, Dr. Bong, thank you so much for being here.
It was an honor.
This is a blessing. And again, all the information is going to be in the description below, links to your website. And I recommend going and reading the things that she has on there. I hope this has been fascinating, interesting to you. And I would just like to say thanks for watching, and may you be blessed in your pursuit of dental health.